Turn our attention back to COVID-19 from the international stance for the moment, shall we? According to research from the African Centre for Strategic Studies, the surge in COVID-19 cases in India is spurred on by a more transmissible variant and complacency, and it's a stark warning. It says African populations need to remain vigilant to contain the pandemic. So what exactly does that mean for you and I this morning? Is this another variant that we might not know much about, but it might be okay if we get the correct vaccine at the right time when it becomes available? So many questions. Research Associate Paul Nantulya joining us. Paul, good morning to you. As you heard in my intro, just help me understand. So another variant that we in Africa need to be concerned about. Help me make sense of what this issue is now.
Yes, hi, thank you, and thank you very much for having me on your show. So yes, we are, unfortunately, another variant, which appears to be more deadly, much more lethal, much more difficult to manage from a public health standpoint, is circulating around the African continent. 7 or 8 countries so far, probably more, as we speak this morning. Uganda was the first country in which this Indian variant was detected. And I think it provides a perfect case study of the kind of effect that this variant is going to have on the continent. It arrived about 3.5 weeks ago. I'm speaking from there right now. And before that, there had been a sense in Uganda, if you talk to people on the street, if you talk to people in the rural areas, in and around Kampala and around different parts of the country, they told you that the first wave was managed. The fatalities were very low. In fact, Uganda closed one of its major treatment facilities in Kampala because, there were just 1 or 2 cases a day, 3 maybe. And so there was a sense that Uganda had actually pulled through. But right now, as we speak, that ICU, that facility has been reopened. Other facilities have come online. ICU capacity is full. Beds are full. Hospitals are overflowing. I'm not being sensational. I'm using language that is being used by the Ministry of Health, by health officials, by doctors, by nurses. There are many people that now tell you, and this wasn't the case even a month and a half ago.
Paul, let me come in. I want to just ask you, before you tell me what people are saying, because I do want to hear that, let me just understand. So the numbers were coming down in Uganda, where you're speaking to us from. It seems at that point there was quite a dramatic pullback on their interventions and on their protocols. Perhaps more the interventions than protocols. Since then, there's been a massive spike. Apart from the hospitals filling up, what other interventions were pulled back on? International travel? Were there more borders opened? Tell me about how the population and the government were managing that. What suddenly increased those numbers, do you think?
Yeah, Uganda opened. The borders were open. Many restrictions were lifted. And people were circulating around. People were moving. The other thing is that people were not observing social distancing, not observing the guidelines, the health guidelines. It was very, very difficult. And the other very interesting thing is that people were also not turning up for vaccinations, right? Mm-hmm. Now, obviously, after the arrival of the variant, there was a massive rush. There was a massive rush for people to get vaccinated. I think probably Uganda is coming close to depleting its stock. So that's the other effect that we see. However, there are certain characteristics of this variant that have created a completely new dynamic. So one, you're seeing more hospitalizations among young people, including children. Second, it's spreading quite rapidly in the rural areas, and really that wasn't the case before, because these are areas that are less populated, they're less dense. People are living outdoors. They spend most of their time outdoors, at least 70 to 80%. But all these elements that were considered, that were responsible for building some level of resilience. Building some level of resiliency in Uganda are no longer applicable. And this is one of the reasons why we warned very, very seriously in our report that African countries cannot let their guard down. I mean, we saw what happened in India. India has very similar demographics as many African countries, right? And it did have many of the points of resilience that I've just talked about. But this variant has kind of put all that on its head.
Paul, let me come in there quickly. I want to just ask, because this is fascinating. This is so interesting to hear what's happening in Uganda and this new variant. I've got two more questions for you, and time is against me, so I'm going to try and just get these questions to you to get your thoughts on this. One, since this new variant, since I'm going to call it another spike in Uganda, talk to me about what the restrictions look like. I'm raising this because we're now currently in a third wave in South Africa, over 8,800 new cases in 24 hours here. Talk to me about restrictions, and then I'm going to ask you about the vaccine and how effective it is with this new variant. First, talk to me about any new restrictions that are in place.
Yes, so essentially Uganda has gone back to a strict lockdown. So curfew is in place. There's a ban on gatherings, a ban on churches, on religious ceremonies, burial ceremonies as well. Funerals and burials. Have been restricted to no more than 20 people. And as you know, in any African context, restricting funerals to that kind of, to those numbers. I mean, this is really something that's very difficult. But it is in place. Movements have also been restricted. Movements out, in between districts have been restricted. There's also the
Paul, let me just come in there. Forgive me. I just want to make sure I get this question to you before I say goodbye, because we're definitely going to have to talk to you again. Just very briefly, 30 seconds if you can. The vaccines that are currently there, any help at all with this now new India variant in Uganda? Are the vaccines helping? Are they effective?
Well, I mean, it remains to be seen. It's new. The vaccination is still being, vaccination campaigns are still being rolled out. There's not enough vaccine to go around. I mean, this is something that's still being looked at. Is this new variant resistant to the vaccines on the market? I mean, that is something that's still being looked at. But the government is really ramping up its communications, encouraging people to get their shots. But even after getting their shots, encouraging them to continue observing the SOPs, the guidelines, the standard operating procedures, as they're known in Uganda, to ensure that the people are kept safe and that people take it upon themselves to be responsible, because they're not just protecting themselves, but also protecting others. So there's a major campaign to get people to turn up for their shots.
Paul, I'm going to say thank you for the moment. I know we're going to talk again, and it sounds like you are incredibly knowledgeable of what's happening on the ground, but Research Associate Paul Nantulya joining us from the African Centre for Strategic Studies all the way over from Uganda.